Welcome to the coronavirus update. I'm here with the DNT correspondent in High Peak City, Michael Amponsah, who has been absolutely phenomenal in terms of keeping us up to date with the virus. And so, with the virus hitting Togo for the first time yesterday, we wanted to chat with him to see if you can share with us some best practices so that our viewers in Ghana can know what to do since it's now knocking at our door. So welcome, Michael. How are you?
Thank you. I'm be here one more time.
Very good. First and foremost, a lot of us have been praying for you to make sure that you being very close to the action, God will protect you, but it looks like you're looking pretty good.
Yeah, thank you. Yeah, that has been our prayer, and we.
So first off, the last time we spoke to you, the African community has still not been touched by the virus. Is this still the case in China?
Yeah, that has been the case until we had a reported case of a Cameroonian who was admitted and was confirmed of the virus. But after a period of 5 to 7 days, he was cured and discharged. And we are told that his immune system was able to clear this virus. It's needing further sort of monitoring. So he was discharged home. Apart from that, there haven't been any African here in China who in touch.
Okay, so
as at then, even
so in this case, was his case only suspected, or was it confirmed that he had the coronavirus?
Well, he was suspected before he was taken to designated hospital for further checks. Actually, he was admitted. On the second day, the virus, the test of this coronavirus on this patients, this Cameroonian patient, proved positive. And so it's a confirmed case, actually. But then, miraculously, after 72 years of admission and going through the normal protocol for the care given to all patients who were affected with this coronavirus, he was cleared by doctors of the facility that he has been cured. And so there was no need for further admission. And so he was discharged to go home and continue on the further sort of quarantine by himself, and also adhere to the precautionary measures that has been taken. And so we can say that the Cameroonian could give us a single case. We can have one confirmed case.
We have a case of a Cameroonian who is African, because you know these days you can have a Cameroonian citizen of a different race, but a Cameroonian whose test proved positive that he had the coronavirus. But within 72 hours, he was discharged. So my question is, did he receive the normal treatment that everybody else receives, or he didn't receive? Basically, his immune system cured the disease itself.
Yeah, sure. Thank you very much. I think we should make it clear that as of now, we do not have a treatment protocol like a regimen for this virus. And so mostly all patients who are admitted in various facilities go through what we call the symptomatic treatment. The symptoms that have been presented by the patient are what the medical team goes ahead to treat. And so apart from the usual coughing, the fever, and what have you, they seek to sometimes give oxygen to patients because certain patients have difficulty in breathing. And so they support with oxygen. These are basically the regimen we have now because there is no vaccine. And so, yes, this Cameroonian went through the same regimen, but after 72 hours, he was cleared of the virus. And so it also gives quest to science as to whether certain school of thought think that we from Africa, so to speak, had some certain level of immunity towards it, though it hasn't been confirmed yet. But the single case of the Cameroonian we had in China miraculously got treated within 72 hours, and he has been discharged and now going about his normal duties as he was.
Okay. So you're saying that there is no treatment for the virus per se, it's just the treatment for the symptoms,
yeah,
right?
Yeah. Yeah.
Okay.
That is it.
And just for clarification, the little that I know about health is that virus have to run the code. There is no treatment for virus. It's just the symptoms that it gives you that medical facilities are able to treat, right?
Yeah, that is true. But mostly, like if you compare this coronavirus to other viruses, like the HSV virus, like the human immune virus, the HIV virus, or the Hep virus, you can see that in other cases, these patients are given immune boosters. They are given drugs that will help them boost their immune system, drugs that will help their liver, because almost every drug that is taken per oral or per mouth will have to go through the liver, for synthesis before the drug is being given to the other parts of the body. And so what happens is that these doctors sort of uses the symptoms. If there is fever, they try to calm down the fever so that this patient will not get into other symptoms like getting into severe pyrexia or higher temperature that can even lead to fits, or getting so they look at the symptom for the virus. However, we have been told that some countries are using certain drugs for HIV patients or certain antiviral agents, and it is working for them. And so, when we talk about the coronavirus, it's actually an RNA virus. There are two types of viruses. We have the RNA and the DNA. The coronavirus is an RNA virus, which is an enveloped in nature. That's where it gets its name, corona. It's like the Latin word crown. And so if you trace the history of viruses vis-a-vis what we have now, you can see that as other viruses, as you said, it's true. It's difficult having a cure. If a patient have sort of immunity, there is a vaccine. We introduce antibodies into the patient's blood so that these antibodies will develop what we call, these antigens will develop antibodies for this patient to get a sort of a strong body syndrome to face this virus. But in our case, we don't have a vaccine yet. And so all that we have now is to treat the symptoms, to try to relieve the patient of any pain, and try to make sure that the symptoms the patient is presenting do not complicate into getting other things. That's what medicine is doing now.
So in this case, when China says that we have so and so confirmed cases and so and so number of people treated and discharged, if you're only treating the symptoms and you discharge them, How do we know that the virus is still not inside the patient whom you just discharged?
Well, in that case, it is the test that will show.
Okay.
You know, earlier on, I've been educating about the incubation period. When we say incubation period is when a patient starts to exhibit the signs and symptoms when the organism has entered the body. For example, if today I'm being bitten by a mosquito, all right, from today till the 4th or 5th day, I'll start having the headache, I'll have the fever, the bitterness in the mouth, those symptoms. From today till that time when I'll start the exhibition, it's called incubation period. That time, you cannot transmit that sort of infection to other people. But with the coronavirus, the situation is different. Even when you are incubating the virus in you, you can as well transmit the virus to some other people. And so that's why it brought about this issue of evacuation when certain countries evacuated their citizens. When they were leaving, these patients all tested negative. Even at that point, we could not. These tested negative. They went through the routine checks and they were negative, free of the virus. But when they got to their respective countries, we saw that after 5 to 7 days, some of them started exhibiting the symptoms. So clearly, it tells us that these people that were evacuated were in their incubation period when they were being evacuated. And so, yes, it's true. When a patient is treated and is cleared, it means that we do not find the virus in the bloodstream any longer. There are tests that are being done to confirm. The difference between the suspected cases and the confirmed cases are that you may be exhibiting the signs, the fever, the coughing, and what have you. But it could be a simple influenza. It could be a common cold or a flu. But once we do the blood test, that can isolate the virus. Then you move from suspected case to a confirmed case. And so if you are confirmed and we say you are treated, it means that we have again tested you of that same virus and you are now cleared of it.
Okay, so then
you get it.
How is it that, so if there's no treatment for the virus itself, but you can only treat the symptoms, then if a patient tests positive and you take him through the symptomatic treatment, as you say, and it gets to a point where he doesn't have the virus again in his bloodstream, then what really happened? Did the person cure himself, or it's a case of what does that mean?
Very good. You know, our system has an interesting way of clearing infections or microorganisms. If you study microbiology, you know that there are certain viruses, our own immune system are able to clear them. A classical example is this B virus. You can test positive today. You will not take any medicine, you will not do any treatment, but you can again test negative. What does it mean? It means that your own immune system, your own body has been able to clear. That is one aspect of it. All right. And so viruses are so important that once a patient having been given inoculation or hasn't been given injection, vaccine, that sort of produce antigens to provide antibodies that will protect the patient. If the patient again tests negative, it only means that his or her own body has been able to clear the virus without needing treatment. It's a case that we've been seeing it in medics for a longer time.
So that brings me back to the Cameroonian guy. So there's nothing different from him when he went through the same treatment that everybody did and got discharged in 72 hours. Meanwhile, we also knew that other
Yeah.
people of other races have gone through the same system. One, they tested positive and they went through
Yeah.
the treatment, and later on they tested negative. So you can also say that those people, their body also cured the viruses themselves.
That's true. Essentially, right. But probably let's look at the rate of this Cameroonian. All right. And
Okay.
even among the people around him, his environment, we haven't heard of any outbreak in his hostels, his friends, his immediate surroundings. It tells you that
Okay.
his own body was fighting this virus even before he went to the hospital. Because even after his
Okay.
discharge, around him, around the African community that he moves with, sleeps with, dine with, we haven't heard of any case among any of his friends. And so that is where the issue of, and especially when we still have Chinese and other nationals traveling onto our continent. But if you look at the rate at which we are recording the case in Africa, it tells you that there is something underlying that is sort of prohibiting. It could be that we have created the awareness so much, we are trying to go through the precautionary measures. That could be the case. But then again, we will need a scientific data to tell us, maybe as a race, as a black race or as Africans, probably there could be an underlying factor that is giving us a sort of maybe a preferential treatment with respect to this virus.
Okay. So this Cameroonian, when he was treated and discharged back to his hostel, people didn't run away from him, did they?
No, no. The people didn't run away, but the situation was that he was advised on self-quarantine, and the hospital actually saw to that. They went and made sure that he was isolated. He was within his own sort of confines so that he wasn't able to. And you know, most students, most African students who actually went on vacation during this outbreak, on their arrival, their schools actually quarantined them. They were not even suspected cases, but they were quarantined. They were given in separate rooms in their various hostels. These were some of the measures the Chinese authorities were using to curb it. And so, yes, once you are discharged, that facility that discharged you also takes it up upon themselves to follow up, because follow-up is part of treatment. But in certain countries, we might not take a cognizance of it. But here, follow-up is very, very necessary.
Okay. So from your calculation, a person who's been confirmed and then treated and discharged, and a person who might be in the incubation period, who is more dangerous?
In this case, I think the incubation period, because for the suspected, a confirmed case, we know him, okay, or we know him or her. And so virtually we are careful about this very individual. We know when to go to him, how to.
I'm saying after they've been treated and discharged, are they still a danger to society?
Well, of course, they can be a danger, because we have also had a case of reinfection, not in the case of the Cameroonian, but in some Chinese. We have had people who were treated, they were cleared, they were discharged, and after a week or two, they started having the symptoms again. And when they were taken to these various facilities, the virus actually confirmed one more time. And so this situation is a reinfection case. You wouldn't know whether to categorize.
So in this case, maybe he was reinfected by a foreign agent, not from within. Is that possible?
Well, that can also be, and that is why science is trying, as possible, but to look at the various strains we have now. We are even told, as at last week, that the virus has divided into two strains. it has the S and the L. So it is an interesting time for us in the medical field, and we hope that we actually understand
before we come to Africa. Before we come to Africa, let me give you a moment to tell us how the Ghanaian embassy in China, in Beijing, how have they performed so far?
Well, thank you. I think that the Ghanaian High Commission in Beijing has done a spectacular work during this epidemic. The staff at the embassy, headed by His Excellency Edward Boateng, has been all over since this sort of outbreak began. He has been on platforms, they are communicating, they brought out emergency hotlines that if any Ghanaian had any issue, if you were suspecting a friend, a family member, or anybody Ghanaian, we should call these numbers. And as well, they liaised with the Foreign Affairs Ministry to sort of acquire some funding for the students in the first place, and also for non-students who are Ghanaians in China. As I speak to you, every single Ghanaian in Hubei province had an amount of $500 US. That's about 3,400 RMB. And that amount can do a lot for everybody living in China, for feeding, for everything, almost basic necessities. This can keep you for months. And so for that, I think they deserve a thumbs up. They've been very, very responsive. His Excellency Ambassador has been on the neck of his staff to make sure that every Ghanaian here is safe in the spate of this epidemic. And so we can say that they've done astronomically well.
Our correspondent in Lomé, Charlotte Yao, she also gave a DNT a report, which we've already aired. Okay. But now, people, you know, in Africa now, we may tend to overreact or even underreact. What would you say should be the best practices that we can learn from China?
Well, thank you. I think that we should be more proactive as a continent. You know, this issue started basically in Wuhan, but of a fact, the whole of China responded to this virus when it started in Wuhan. Because I don't know, maybe probably it's because of the decentralization here in China. Because city authorities and that of provincials take responsibility and sort of do the needful. All right, there is no need for panic because, excuse me to say, this virus we cannot see on the streets walking. And so all we need to do is the isolation, very, very necessary. Then the personal hygiene, okay? We should wash our hands often. You see, we shouldn't be able to even count the number of times we wash our hands in a day. Once you get out, even when you are in your own confinement, once you touch something, when the postmaster gives you a letter, this envelope came through a channel, all right? Maybe to press your letter, your envelope, put it on your bed, your child will sleep on these bed sheets, and who knows? So anytime you touch anything, whether living or even, we should make it a point to wash our hands. Very, very necessary. Hand washing in itself, apart from this coronavirus epidemic, does help reduce to a larger extent certain microorganisms, though it cannot be 100% cleaning from it will decrease or it will mimic their activity. So hand washing, number one. Number two, we should not be sort of touching certain places like our faces, our mucosas, our nostril, and you know, these are certain things that even culturally we frown on as a people. And so in these times, we should sort of encourage our population to do same. This is basically through droplet infection. When we say droplet infection, we are talking about the use body fluids like especially saliva or tears or from the mucosa, urine or what have you. And so it is important that we always keep entry into our body, which is first and foremost the skin, the largest organ. We should keep it away from this virus. How do we do that? It is only through hand washing. When you wash your hands thoroughly, even if there are pathogens, microorganisms, their activities, we don't just wash our hands with ordinary water, with disinfecting agents that would help us to reduce or mimic their actions, as I said. And so when we do that, we prevent or we protect ourselves to some extent. Then again, we would also talk about the putting up of these masks, the nose or the face we've been talking about. You know that in our daily lives, when we talk, we meet without we even knowing, okay, sometimes it will touch on another person's skin. And when your skin are so porous, the membrane are so porous or so sort of opened up, it can just enter indefinitely. But then again, with this coronavirus, we should note that the virus sort of binds with receptors, and these receptors are in our respiratory tract, okay? And the opening of the respiratory tract is the nostril. That's why there is the need for us to cover our nostril so that the virus do not get in to get a receptor in this respiratory system, binds to it and start disturbing us as a people. And so we need for us to make sure that external fluid from other people do not get into us. So that's by way of preventing or trying to sort of barrier protect ourselves from the virus. This is what we should do as a people. No need to panic, no need for alarms.
Okay, there is a video of a lady who made, I don't know if you've seen it, but she was sitting in an office and she used paper towel, she clipped the ends and she used it as a mask. I mean, in Africa where people may not have the money to go and buy masks, would you say that one will suffice? First of all, have you seen that video?
Well, okay, I haven't seen that video yet, but then again, we should know that even these masks, we have types of them. The surgical mask is disposable. It's a single-use mask that after using, you just have to discard it off. And we have other types of masks like the N95 and what have you that could be reused. And even that it's not for so sometimes probably 2-3 days, or if you are extremely neat, then maybe it can go beyond that, or depending on what you do with a mask in the course of it. So all you need to do with, if you do not have money to be purchasing these masks, yes, you can improvise with the paper or some tissue, a cover, but the underlying factor is there should be a barrier. There should be a barrier. And you should not cover your nose with something that you cannot breathe. If you can't breathe, that is another more severe thing that can take you off even before the virus gets in. And so something that air can pass through, but you know, this surgical mask, what we call the 3-ply. Okay, even when you pour water carefully into the water do not sink down. It tells you that the sort of membrane in these masks that we use to protect ourselves, they have a barrier to some level that even very minute particles could not or cannot go through.
Okay, you, Michael Amponsah, would be known as Dr. Michael Amponsah because you're a medical student in China, correct?
Yeah, sure. Yes, please. I'm
Okay,
currently
so
having my
what?
internship.
Okay, very good. Because we really appreciate the fact that you reported this thing to DNT on an exclusive basis, but you've actually been very technical about it. So at this point, what I want you to do is speak to your doctors in Ghana and in the rest of Africa. How do they handle someone who walks in who exhibit the symptom? Do they just push them out and run away from them, or help the person?
All right.
And how
Thank
would they
you
do
very
so?
much. To my colleagues across the continent, when a patient walks in suspected of the virus, first and foremost, as we know as medical practitioners, there is no need to panic. We need to sort of empathize with this person, but we should sort of provide protection. There should be barrier. We should be in our mask. We should be in our gloves. We should be in our aprons. There should be protective wear. That is very, very necessary. If possible, goggles, we should put on goggles. Anything that will cause sort of an exchange of fluid, whether from you to this person or from the person to you, should be prevented. It should be eschewed by all standards. And so after we have done that, and the normal admission protocol that we have in our various, we can do that. But then again, we should look at quarantine excesses that needs to be done. That is very, very necessary. I know almost all health facilities in Africa do have quarantine or isolation wards, okay, or special wards. We have different names for it. Sometimes we call it the fevers unit, sometimes we call it isolation. These are where we keep certain case nature. And so we should sort of separate from the other patients in the first goal, and it should be trained personnel. We do not leave certain these patients to unskilled practitioners. Okay, there are students on the wards who are curious, who wants to learn, but in the attempt to learning, they might sort of take something onto themselves that could spread across the population. And so please, let's keep an eye even on the health team, especially students, nursing students, medical students who might be on the ward, because they would want to learn about it. People would want to ask questions. And this is the time most professors will be asking questions around this virus. And so, as it may, students would want to go a step further to understand and know about this virus. But we shouldn't expose them too much. Whatever protection the medical team are having, we should give same to anyone who is going near these patients. Then again, the routine checks that we've been doing, when the patient comes, the vital signs that we go through, the temperature, pulse, respiration, do that protocol. Then again, the blood analysis that we need to go on for this, we are aware. Then again, most health institutions, as of now, may not have the test kit for this coronavirus as of now. But then again, referral is part of it. We should not keep cases onto ourselves, trying to be all know all, trying to sort of deal with cases that we actually don't have the capacity to do. Stabilize this patient. Is only proper that we do refer this patient to higher facilities who have the sort of skill, who have the equipment to do the blood analysis, so that we can know whether this patient still remains a suspected or a negative or a positive patient. These are some of the things I would like to colleagues across the continent.
Very good. What about nurses? So somebody comes in, the doctor is protected, he has done all the precautions, they put this person in isolation wards. You know, in Ghana, there are nurses who say, I'm not going there. You know, what do you say to nurses? Because since this thing has come, there's going to be training, but we don't anticipate that everybody will be trained on it. What do you say to nurses who are encountered with this problem where they have to go into that isolation ward to take care of this individual?
Okay, thank you very much. To my colleague, I was a nurse before, practiced as a nurse for 5 years, and so I understand this profession equally well as medicine. To my nurses across the continent, as we know, we say nursing is a cause, and when we look at the WHO definition for nursing, we are trying to help these patients to do things that they actually been able to do. Okay, things that these patients could do if they were not sort of in the predicament they find themselves. Okay, if you look at our model that we look at, Florence Nightingale, if we look at the definition, how Florence sort of took care of soldiers after the Second World War, that is actually what is giving us nursing these days. And so please, we should go on. Yes, after we've been protected, we have the barrier. Nurses across the continent, I'm pleading, doing phenomenal work for us over the years, and we are counting on you that you these patients are not outcasted. They have come to us for hope in this year. They've come to us for support, and so we should be a fortress in these times. For them, we are to sort of be their advocate, because this is when even family members will be running away. And so we are to be their family members at that material moment.
You know, in Ghana, there's trotro, which is not air conditioned, it's free flowing. Okay. Sometimes it can get very hot.
Yeah.
And then there's also VIP or STC that are air conditioned. If I'm sitting in one of those and somebody is coughing and I'm scared, what do I do?
Yeah, you should cover your first of all, that person coughing should take steps to sort of protect, sort of cough in a tissue, or you should be in a mask. You should not just cough in public anyhow. And I think this is the time transport unions should start this education. Okay, even if they could be given a disposable mask at the stations, that wouldn't be bad, so that passengers could sort of cover themselves, because now the virus is knocking on our doors. We have a conference in Togo.
Okay.
We are not saying that sort of it cannot happen in Ghana. Neither are we saying probably we are expecting it or something, but we should be proactive. And so if you are in any of these transport means, you should first of all make sure you have enough tissue, you have a mask. Under no circumstance should someone cough on you during this time.
Okay, do we have any indication as to whether the virus is more potent within an air-conditioned environment or more potent in a non-air conditioned environment? Do we know that?
As at now, there is no data, there is no scientific or empirical evidence to support say. And so we will leave it. There are some relative academic articles about the virus not being able to survive in sort of higher temperatures. But that logic is defied. Why do I say so? I'm in China, but the temperature in my city is just like we have in Tamale. Sometimes it's hotter than Ghana, all right? And we had cases here. We even recorded about 5 deaths in high-cost city, all right? And so it tells you that the issue about weather or temperature, as of now, we don't have a scientific data to support say. And I've given an example, like classes of my city. If you look at Wuhan and other cities in China, that they are mostly like in the temperate zones. Their temperatures are down, That is where the virus erupted. That's why we called Wuhan epicenter. But then again, we cities that are far south, okay, on the islands where the temperature is very hot, we were still having cases to the extent that we even recorded deaths. And so we should not be oblivious of the fact that this virus, excuse me to say, has no respect for zones or for a race or for any kind of people.
Okay. Well, Michael, you have done phenomenal, but there's one thing that I want you to touch on. You made a very significant donation to some people in China, and you were featured in the newspapers there. Can you tell us about it?
Well, thank you. I think that this profession, this whole profession of medical profession is a calling. So, in as much as we trying to do things for the patient given us by government and others, as individuals, we have a clarion call of ourselves. I look at it as an internship student, 6th-year medical internship student who has been told to stay away from the hospital. I've virtually been away from the hospital, getting to 2 months now. And I see my senior colleagues who are at the forefront trying to do the best. We've had cases, we've heard news articles about shortage of masks. And so I thought of it that, yes, maybe I may not have much now, but at least something little to help my widow, to help those at the forefront, because I'm resting, I'm at home, sort of cross-checking news and doing other things. So my senior colleagues, they need to be protected. Universities too. So I sort of gathered funds from my own savings and I purchased some N95 mask of about $1,500 and donated to the first affiliate hospital in High Cost City. And I also did same for Hainan Medical University. That's my university where I was trained. And so that has been the news so far.
Very good. Thank you so much, Michael. You're an exceptional individual. Keep doing what you're doing. Keep providing the rest of Ghana with information on this virus that we don't know much about. And isn't it interesting that you, as a medical student, is in the center of where one of the most dangerous viruses? That's an education for you, and all indications are you're living up to it. So we thank you, and we thank your heart also. You didn't have to make this donation, but you did. That says a lot about you. So thank you. We'll be calling on you for more information about this coronavirus. And so thank you for your time, okay?
Thank you too. Thank you.
That's Michael Amponsah, DNT correspondent in Haikou City in China. We'll come to you again. Stay tuned.